Friends and colleagues, thank you for joining us at the third plenary session of the 46th World Hospital Congress. Please give a warm welcome to the chair of this session, Dr. Jonathan Perlin, President and CEO of the Joint Commission Enterprise.
Hola y bom dia. It is great to be here with you this morning. What a fantastic conference this has been. We know from Dr. Delgado yesterday that when we express gratitude, we find more joy and meaning in our work. And so I think we should all express gratitude to our colleagues at the International Hospital Federation for the best World Congress yet. Our message this morning is a message of urgency. It's a message of hope, and it's a message of optimism. Our topic, of course, is sustainability, and it's a message of urgency because as responsible health leaders, we all need to know the facts about climate change and the impact of healthcare. It's a message of hope because there are things that we can do. But most importantly this morning, it's a message of optimism because our colleagues are showing us what can be done. And that's what this morning's session is all about. So let's start with the facts about sustainability and healthcare's impact. I'm sure by now we've all heard the statistic that if healthcare worldwide were a country, it would be the fifth most polluting country. Worldwide, in most countries, healthcare is about 5% of the carbon footprint. In the United States, unfortunately, we're overachievers. It's almost 9%. So in my country, we don't have a moral opportunity, we have a moral obligation to make a change. Climate change and healthcare, not just an issue of environmental justice, but an issue of health equity, and ultimately of patient safety. Let me explain. Many of the countries that contribute least to greenhouse gases are at risk of eradication because of climate change. Kiribati, Maldives, Vanuatu, Tuvalu, Solomon Islands, Samoa, Nauru, and in the Chesapeake Bay island known as Tangier will all be gone by 2070 if we don't change our course. So it's an issue of environmental justice, but it's also an issue of health and health equity. What's changed in the last year has been the impact, the visibility of climate change in the world around us. In the United States, for most of the summer, much of the country woke up to orange skies and a red sun from the wildfires in Canada. And Maui, Hawaii, was almost destroyed by wildfires. Had flooding in the United States too, in Northern California and Montpelier, Vermont, but nothing compared to the damage in Bangladesh and Libya. And the hurricane just this week that hit Acapulco, Mexico. Never before has a hurricane increased in speed from Category 1 to Category 5 so fast. So the world around us is changing. The receptivity to tackling climate change has really been fostered by what we're seeing, what is inescapable as a truth around us. Climate change is also a matter of health. And as a matter of health, we're seeing diseases and impacts of extreme heat. According to Jeff Goodell, who has a new book, The Heat Will Kill You First, in 2022, there were 250,000 deaths worldwide from firearms. There were 489,000 deaths from extreme heat. In 2022, 30 million people worldwide live in extreme heat areas. By 2070, that number goes from 30 million to 2 billion. It's not just respiratory and cardiovascular predispositions in extreme heat. There are waterborne diseases like malaria and vector-borne diseases from mosquitoes and ticks. You may think of mosquitoes as just sort of noxious predators, but they're the apex predator, as has been written. In all of history, there have been 104 billion people who've lived. 52 billion of those individuals died from diseases carried by mosquitoes. When I trained as a medical student, which wasn't all that long ago, chikungunya in the United States was a footnote because it was a tropical disease. Today, if you drew a string around the world, around the globe, at the latitude of the US-Canadian border, And if you pulled that string to where we are here in Portugal, going from the north of France all the way to the Ukraine, chikungunya is no longer a tropical and subtropical disease, it's endemic. And dengue has increased from about 500,000 cases in 2000 to 5.2 million cases in 2019. Breakbone fever, Lassa fever, Rift Valley fever, et cetera, are all part of that. And it's a matter of health equity as well, because the most vulnerable are the least able to compensate, the least able to buy themselves out of harm's way. And it's a matter of patient safety for this reason. The more the climate deteriorates, the more health care we'll need, and the more at risk our healthcare organizations are. In the United States, according to the T.S. Chan School of Public Health, 81%, 4 out of 5 primary care clinics were closed for at least one day because of an extreme weather event attributable directly to climate change. And that means that we can't be there at the time of need. So this is our call to action. It's not the crisis of our time, it's the crisis of all time. And that's why I couldn't be more proud of the International Hospital Federation for standing up the Geneva Sustainability Center, and our organization, Joint Commission International, is so very proud to partner with the Sustainability Center in tackling climate change, because there are things that we must do, and importantly, things that we can do. Joint Commission was jointly founded by the American Hospital Association and organizations of physicians and surgeons in 1951. The goal that all people always experience the safest, highest quality, best value health care across all settings. And so climate change clearly is in the remit of patient safety. The number one accreditor around the globe, and the gold seal that is earned from challenging oneself to excellence, is a demonstration of that commitment to excellence. This morning, I want to announce that in the United States, we have announced a new certification program in sustainable healthcare. Begin on January 1st, and it includes standards for measuring and reducing greenhouse gases. Engages organizational leadership in developing action plans for reducing at least 3 sources of greenhouse gases and waste. But importantly, I announced that we are partnering with the Sustainability Center in new standards, which are currently out for consultation, that will be part of the accreditation manual, 8th edition, to be released in January 2025. They call for work in terms of governance, employee engagement, procurement practices, improving infrastructure, and use of environmental resources. There will be resources that we have at our JCI Sustainability Resource online website. It will attach to the Sustainability Center's great resources, including the Sustainability Accelerator tool and the CELL program for lowering carbon as well. I have a very important announcement this morning. Those standards that we are releasing will not be proprietary. They will be in the public domain. We have a challenge. We don't need multiple sets of standards. I used to work a lot in information technology. There used to be a joke, aren't standards wonderful? There are so many to choose from. There is no standard if there's cacophony. We have one crisis, one world, one common purpose, and we invite all to join in this use of common standards. Let me just get back to facts for a second. When we think about greenhouse gases, we tend to think about the 3 scopes, and I simplify it to the things that we do, the things that we burn, and the things that we buy. In terms of the things that we do, hospitals are incredibly energy intensive. Hospitals consume 2 to 5 times more energy than office buildings, and ORs are actually more energy intensive than the heaviest of heavy industry. In terms of scope 1, I should have said that we use a lot of fluorinated anesthetics. And even though scope 1, the things that we do, the anesthesia and the metered dose inhalers, are only 7%, there's a problem. Isoflurane and desflurane, those fluorinated anesthetic agents, are 1,500 to 3,600 times more warming than carbon dioxide. So a little bit of damage goes a very long way. In scope 2, I mentioned the energy intensity, and it also applies to the consumption of water as well. And in scope 3, the things that we buy, and in fact the things that some invest in as well, is a problem because the waste associated with healthcare is substantial, on the order of 10 kilograms of waste per patient per day. And that means for 100 beds, it's 1 full ton of waste, 15% of which is toxic or infectious or otherwise. So today's remarkable panel tells us not only what we can do, but shows us how to do what we need to do. The first principle, of course, is that we are all focused on the greatest carbon efficiency, which is producing health, diminishing the need for health care, diminishing especially the need for hospitalizations. Today's panel shows us that we can make a difference. And in particular, low and middle income countries inspire us in other countries, upper income countries, that we must do more. In fact, Dr. Hamid Raghidi, who is the regional advisor for EMRO, the Eastern Mediterranean region, notes that deaths attributable to climate effects are 8 times higher in low-income countries in EMRO than upper-income countries. And so let's take those 3 scopes, the stuff we do, like anesthetics, the power and fuel we consume, scope 2, and what we consume, scope 3, as we think about this terrific panel. In Shengung Medical Foundation, we'll hear on scope 2 in the Go for Green project, and MP Shaw Hospital in Kenya will have absolutely inspiring work addressing all 3 scopes of greenhouse gases. From the Emirates, we'll hear about sustainable development and clean energy addressing scope 2. And right here in Portugal, an Excellence Award for Green Hospitals Award winner, we hear from Centro Hospitalar Entredouro e Voga on their waste reduction in surgery, and particularly cataract surgery. And from Apollo, we'll hear about their tons of carbon waste avoided through their Smart Joules program addressing scope 2. And importantly, there are examples at the national scale. The National Health Services for a Greener NHS campaign, which aims and is on track for net zero by 2040, demonstrates what can be done at country level and was architected in part by a very special person. That individual is the director of the Sustainability Center, our very own Sonia Roshnik. She'll facilitate a discussion that highlights what can be done. By the way, there's a difference between hope and optimism. Hope is a positive feeling. Optimism is that feeling based on data. This is a discussion about that data. Please join me in welcoming Sonia Roshnik to facilitate this important conversation.
Thank you so much. Thank you, John Perlin, for such great leadership. And isn't it wonderful that an organization that we can develop standards with is going to make them available to all other accrediting organizations, so we can have one set of standards and actually not reinvent the wheel all the time. So thank you so much for your leadership on that. So yes, we've got a fantastic panel today. We're going to be traveling from Taiwan to Kenya, to the UAE, to Portugal, and to India. And I'm hoping that we will have a lot of participation from yourselves. So please do use the app to pose questions, because I've got an iPad. I'm going to be picking up your questions. You can vote up the ones you like most, and we'd really like to engage with you on how we can demonstrate that we can make progress and overcome these numerous challenges. But just first, before we get started, we've got a key message from Dr. Maria Neira from the WHO, who couldn't join us today, but has addressed us nonetheless a call to action. So please let's watch that video just now.
Dear participants, excellencies, dear organizers, thank you very much for inviting me. Greetings from Geneva, the World Health Organization. I'm extremely honored to be part of this World Hospital Congress, and I thank you very much for this invitation. We are on a very critical moment. In few weeks from now, we will be at COP28 in Dubai, where countries will be negotiating the reduction of emissions to fight, to mitigate, and to adapt to climate change. What this represents for the health community? For the first time ever, we will have at the COP negotiations a health day. That's why it's so important that the health voice is very loud at the COP28. We need to make sure that everybody understands what we know very well, that climate change, the climate crisis can now be considered as a health crisis. Climate change is having devastating, very negative impact in our health, and therefore we need to react and lead the transformations that are needed to make sure that our health will be more protected. What we need to do is to make sure that everybody understands the negative consequences of climate change and health, and therefore they realize that when they are negotiating at COP, they are not just negotiating the reduction of emissions or the mitigation, they are negotiating with our health as well. And as the health community, we can do something very tangible as well. We can decarbonize our health system. We can make sure that the health systems of the 21st century, our hospitals, are fit for that purpose, for the challenges we are facing. Our health system needs to be adapted to climate change, ready to cope with the consequences of climate change. They need to be low carbon, and for medium and high income countries, we can go as far as reducing emissions, decarbonize our health system. You know very well that globally, the health system contributes to more than 5% of the global carbon footprint. And therefore, it's very rewarding. We see now how health professionals are contributing to this decarbonization, giving us very good successes and motivation for the health professionals. I'm sure by now you all know ATTACH. ATTACH is the Alliance for the Transformative Action on Climate Change and Health. And if you don't know it, I'm inviting all of you to join very quickly, because we have a lot to learn together, to implement together, and reaching incredible targets as soon as possible on our supplies, on our procurement, on our healthcare, and of course on promoting digital medicine. And I will invite you as well to sign a call for action on climate change and health, to make sure that the health of the voice professionals, the health professionals, will be sitting with us at COP in Dubai on the 3rd of December, when we will have the Health Day. Thank you very much, and have a very successful Congress. Thank you.
Thank you so much. So please take a minute, if you've got the time, to respond to this call for health. The Conference of Parties that's happening in Dubai in about a month's time is a really important moment, because it's the first time that they've started to think, yes, actually, the environmental crisis does impact on health. And as Maria Neira said, this is not an environmental crisis, it's a health crisis. And it's going to touch all of us because of all the things that John Perlin highlighted. So it's really important that that voice is represented, and that hospitals around the world can highlight what can be done about this, and also how we can accelerate action in doing so. I just wanted to say something about ATTACH that she mentioned as well, because there's 70 countries around the world where the ministries of health have signed up to decarbonization and to resilience building. And there's a real movement now that's trying to look at how we can go there. So I'm delighted that we've got standards and that we've got tools that will support people going forward. But mostly, I'm so pleased that we've got this wonderful panel here today. And I'm going to invite our first speaker, Professor Dr. Wen-Jen Cheng, who's chairman of the steering committee at Changung Medical Foundation, Taiwan. Thank you so much.
Good morning, everyone. It's my honor to be here. At the beginning, I will introduce Taiwan in brief. Taiwan is located in the East Asia, in the Western Pacific Ocean. Taiwan, also known as Formosa, has an area of 36,000 square kilometers with around 24 million inhabitants. Annual household income per capita reached $17,000 in 2022. It's quite the same as Japan and South Korea. Now I begin my presentation. Net zero emissions is an important initiative, not only in the world, but also in Taiwan. Taiwan's legislative yuan passed the Climate Change Response Act in January 2023 to impose a carbon-free in multiple phases. Taiwan's President Tsai Ing-wen pledged a 24% reduction in emissions by 2030 and the net zero emissions by 2050. The largest energy consumption of non-production industry is hospital in Taiwan. Out of the 22 medical centers in Taiwan, Chang'an Memorial Hospital, CGMH, is Taiwan's biggest health care system. We operate 10 hospitals with a total capacity of 11,000 beds. However, CGMH's annual power consumption per unit area was 210 kilowatt per hour, which is much lower than the 267 kilowatt per hour from the average of the other 21 medical centers across the country. How did we do it? A top-down approach that requires push strategy along with a tailored management mode. We set up a special organization for energy conservation and carbon reduction. The organization initiated, sustained, and expanded various green initiatives, like a new course, process, digitalization of green-specific information technology. The management model is applicable for all the foreign and not limited to new equipment maintenance process, efficiency management, energy-related monitoring and control, and the medical records and the technology, and the corresponding review and audit process. Green transformation requires concurrent improvements, including green buildings, conservation, procurement, transportation, low carbon diet, consumption control, waste reduction, smart hospital, etc. All buildings of CGMH have been certified as a green building since 2013. Our Proton and Radiation Therapy Center received the Green Building Diamond Award, LEED Healthcare Platinum certification in 2014. It's the first one in the Euro-Asia area. 50% of the green spaces is planted with native species and climate-adapted plants. A rainwater recycling and reuse system has been established, and 40% of the interior is made of green building materials. CGMH has invested more than $30 million toward a green-friendly hospital in the last 5 years. It included greenhouse gas and energy management investment to achieve the goal of 1% carbon reduction per year. We also have been actively advocating and implementing the concept of waste recycling. For example, recycling of hemodialyzed waste plastic outer bag, commonly used by dialysis patients. I hope the above summary provides a good background of CGMH's net zero effort, which is a continuous journey toward the net zero goal that aims to effectively reduce carbon emission. Thank you.
Thank you so much, Professor Dr. Wen-Ching Jern. Next, I'd like to call upon Mrs. Tosif Din, who's Chief Executive Officer, MP Shah Hospital in Kenya. And please do use your app to start asking questions, because we'll be wanting to hear all about your thoughts as we go forward after all the speakers.
Thank you. Thank you very much, Sonia. Bon dia! And to my Kenyan colleagues, Jambo! Jambo! It's great to hear from you all, and a very good morning to you, ladies and gentlemen. I come from the beautiful country, Kenya, that is blessed with beautiful, lush green forests, pristine sandy beaches, and I must say, the world's fastest runners. The MP Shah Hospital's vision is to be the premier patient-centered tertiary healthcare institution in East and Central Africa, with a mission that is committed to delivering excellent healthcare every day. Today, as I speak to you about our Green 365 journey, I want to begin by sharing a story with you. A story where we traveled 7 hours away from Nairobi to a place called Samburu County to conduct cataract surgeries on individuals who hadn't seen this beautiful world for over 10, 15, and even 20 years. And after conducting cataract surgeries, it was the final day for us to open the bandages. And we opened the bandages one patient after the other. And this particular patient, when we opened his bandages from his eyes, ladies and gentlemen, the first thing he said after 15 years is, "Where are the trees? Where did the trees go?" It is inspirational stories like this that make us think that there is so much more for us to do when we are saving this beautiful planet. And therefore, in 2019, through painstaking efforts, we started our Green 365 journey. 365 because we wanted to be green 365 days of the year. It wasn't a flavor of the season. It was something that we wanted to pioneer for 365 days. And in 2019, we launched 365. We started with small steps of planting trees across the hospital, and we launched our green policy book. In 2020, we formed a Go Green committee. We installed green champions from among ourselves, and we also had green key performance indicators. In 2021, we became signatories to the United Nations Global Compact. In 2022, for the first time in the history of MP Shah Hospital, a hospital that is 90 years old, we conducted our first environmental impact assessment audit and started implementing its findings. We launched an e-waste campaign, and we have so far collected 397 kilograms of e-waste since 2022. And we also launched our textile recycling program, and so far we have collected close to 3,000 kilograms of linen. In 2023, ladies and gentlemen, we became the first hospital in Kenya to create awareness for greening healthcare, and we celebrated World Earth Day, and we stopped using nitrous oxide in our operating theaters. Ladies and gentlemen, these are just small, effortless initiatives that we have taken as leaders. You as leaders have the power, you have the influence, you have the position, you have the titles to be able to push the Green 365 agenda. We are role models, not only to the institutions that we work for, but we are role models to our children, to the next generation. Ladies and gentlemen, this is an urge, it's a call of action to each and every one of you here, that there is so much that we can do with our leadership positions. There's so much that we can put forward out there and save this beautiful planet. Let's do this together, and let's keep soldering on. Thank you for being a wonderful audience.
You can feel the energy, can't you? Thank you so much. So now I'd like to ask Her Excellency Mubaraka Ibrahim to come to the podium. She's Chief Information Officer for the Emirates Health Services in the UAE. And that's quite an interesting position to be doing this from. So thank you so much.
Thank you. Doctors, Excellencies, distinguished guests, colleagues and friends, it is an absolute honor and pleasure for me to be here with all of you today. And first, I would like to thank the IHF team for their immaculate work for convening us here at this event. Being here for the first time, this is an inspiring and exhilarating, for me to realize that what is actually having us all here and bind us and connect us is our passion in healthcare. Healthcare industry is reported to be 4.4% of the global greenhouse emissions. If we were a country, we would have been the 5th largest emitter in the carbon dioxide. Let me bring to your attention that the World Health Organization has called the climate change the biggest health risk of the century. It is estimated that between 2030 and 2050, the climate change will cause approximately 250,000 deaths additional per year. You know, this number baffles me, and I think it should baffle all of us. But I firmly believe that today's conversation is of utmost essence for all of us here as ambassadors of the healthcare industry regionally. We all need to commit to obsessively examine every single possibility to explore all the technologies that we can leverage to do a deep dive in achieving the net zero. Standing here, of course, I am filled with confidence and hope that we can come to our common goal. I'm coming from the United Arab Emirates. We are led with a vision by our leaders who have established the year 2023 as the year of sustainability, themed today for tomorrow. We successfully have implemented the National Unified Medical Record in all our facilities in the United Arab Emirates, whether it was private or government, using our health information exchange platform called Riayati. We have around 11.4 million unified medical records. We are able to save around 5,400 tons of paper, which can save the environmental impact immensely. At EHS, we constantly on the lookout to instill a tangible progress addressing sustainability. Definitely that will happen in alignment with the UAE strategies and initiatives such as the COP28, which has been mentioned earlier, National Climate Change Plan, and the Net Zero 2050. We in the EHS has built the next generation data analytics and AI platform. And I'm proud to say that this platform is accelerating for us and our leaders the decision-making across all the levels, whether it was strategic, tactical, or operational, for all the portfolio of the EHS, which entails around 130 plus facilities in all the Northern Emirates. Powered with this platform, we have achieved awareness in the carbon footprint enhancements for the virtual care coverage and definitely an exponential adoption rates in the virtual clinics. And therefore, we have accomplished a carbon emission by 20% with all estimated savings of 2 kilotons of emissions. Allow me to assure you that we in the United Arab Emirates, this is just the beginning of our journey, and I take immense pride that we're going to be actually utilizing this real-time analytics for a better decision-making. I would like to conclude by saying, above and beyond, and all facts and figures and facets attached to it, for me, sustainability is deep-rooted responsibility. Our parents and their parents did a phenomenal job of handing over this, planet to us in the best possible way. It's ingrained, it is in our blood and genes, and I think they have passed this for us, and we have to respect it, embrace it, share it, and adhere to it, to our culture, and live our lives around sustainability. We owe it to our parents, we owe it to our children, we owe it to everybody right now. And I urge you that this conversation that will happen today about sustainability is not just at the work front, it is also at the home front. It starts from our homes, it starts with us. Thank you very much.
Thank you very much. It is something that we need to do at work, at home, and everywhere. And thank you for reminding us how we owe it to our forefathers and to our children and grandchildren. So now I'd like to call Dr. Miguel Paiva, President and Chief Executive Officer of the Centro Hospitals Entredauro Evuga. I'm sorry that I'm not pronouncing that very well. Welcome. Thank you.
Thank you, Sonia. Thank you, Jonathan, and all colleagues of this panel. And good morning. Good morning, everybody. Bom dia, saying in Portuguese. I'd like to start thanking the Geneva Sustainability Center and the IHF for this honor to be here, sharing this stage with this fantastic audience. And I would start saying that nowadays the word of the day is sustainability. We hear in the general agenda sustainability always. We hear about sustainability, financial sustainability, social sustainability, government sustainability, and environment sustainability. Why are we speaking so much about sustainability? Well, of course, we speak so much about sustainability because our society is under big stress in all these domains. We are in big stress. And if we are in big stress, only we can overlap this situation if we change. Because if you are in stress, it's because something is not okay. And to correct this, it's necessary to change in all these domains. And of course, I'm speaking here about environment sustainability. And change is only possible with action. We don't change if we don't act. And the action and changing is very, very difficult. Very difficult. We know by our experience in our organizations, when we want to change something, people react. It's not difficult. That's why any change is only possible with positive and collaborative leadership. That's the importance of leadership. And in this stage and in this audience, there are a big number of worldwide leaders. And so we have the responsibility to impose this change, to make this change, and we can and we have some opportunities of doing this change. And I'll speak a little bit of what we have done in our hospital center, and following the recently updated leadership and management competency directory that the IHF just made. This was made with the collaboration of a number of experts globally. And the good news is that in this update of the leadership and management competency directory, it was the first time that the environment is included. This means something. This is the very good beginning. This means that worldwide, this is a conscious in people that is leading organization. And so this is the big opportunity we have. And in our organization, we are trying to follow this competency model that has two enabling domains, which is the values and the self-development of people. This means that by the values, we have to guide our organization and our people, and we have to inform the decision-making. So let's include low carbon and let's include sustainability care in the values of the leadership and in the values of our staff. The second domain is the self-development. We have to lead with the right knowledge, and we have to develop the proper competencies of our people, of our leaders, our mid-sized leaders, and our staff. This is very important. We have to stress the environmental sustainability and the importance to study and to read and to measure our organizational situation, and we have to train our people. It's finished now. We have three action domains, which is the execution. We have to implement and an active, effective efficiency in the efficient way, create a set of actions of programs aiming the environmental sustainability in our organization. Another domain, another action domain is important, very important, which is relations. We have to listen to our staff and our patient concerns adapt, and have to adapt a compassionate, solution-oriented approach. We have to involve staff. We have to empower them, and we have to expose them as leaders of projects. People are more oriented if they think they can make the difference. And we, as leaders, we must make them think that they can make the difference. And then that's a transformation. We have to guide our organizations in a way that you made systemic changes and advance care service based on real needs of common vision and trust. We have to include sustainability, environment sustainability, and low carbon in our healthcare services provided in the transformation of our organization needs. In our organization, Centro Hospitalar em Dorivoga, a medium-sized national health service institution, we are doing this. We put environment sustainability in the values of our organization. We are putting the self-development goals in our leaders. We are a lot of them are here, nurses, doctors, that are implementing the projects, showing their commitment with this objective. And we are doing a lot of projects: energy changing, reutilization, telemedicine, reducing carbon waste, measuring the waste, etc. We are executing already. And we promote the staff involvement. We create a group of leaders among the organization that they have the environment they are environment ambassadors in all services. We are more than 50 people in the organization, which are ambassadors in each department, each service of our organization, and we all also implemented purchasing policies with environment conscious. So we are transforming our organization in a lower carbon emissions and more sustainability healthcare provider. In our days, we tend, when we have a problem, to say, this is people which is the problem. They are not conscious. They don't take care on the use of resources. And this is completely wrong. The problem is not the people. When you want to change people, you not succeed never. So if you want to succeed, you have not to change the people, but you have to change with people. Thank you.
So sustainability is a leadership competency that we can all embrace and integrate, and thank you for your call to action to all staff. So I'd like to invite Dr. Karan Thakur to come and talk to us. He's the Vice President of Sustainability and Public Affairs at the Apollo Hospitals Group in India. Thank you, Karan.
Thank you. It's a tough act to follow after hearing such inspirational stories and ideas. Namaste from India. I represent the Apollo Hospitals Group. We are India's largest integrated healthcare player. And I'd like to touch upon the power of the organization and how, when you have formal structures in place, you can really make a difference and you can actually accelerate not just what you want to do, but also make the impossible possible. In the year 2021, the Apollo Hospitals Group put together the Apollo Sustainability Action Plan, very neatly named ASAP, which also shows the intent on moving fast on the climate crisis and climate action. And this organization that we put together was actually 4-tiered within the organization. We have a board committee now, which is designated for sustainability. So action and what we need to move on is being directed right from the top. And once our leaders are involved, they're looking for not just momentum on the ground, but also measures that we can actually showcase to the world that, this is possible. Below that sits the Central Steering Committee. It's people like myself who have to report upwards to the board, but also help colleagues in how they can actually move the needle within their organizations or as part of their value chain. And below that is the Sustainability Council. Every CEO finds a place in the council so that their voices are heard and they know what is the desire from the top. And most importantly, every hospital, every part of our business vertical has a green team. These are the folks who are actually delivering on the ground, and we hear from them, and we then plan the next course of action through those feedback that we get from them. So this 4-tier structure has been incredibly successful for us, and it shows how we can take a whole of the organization approach, create structures, but not get stuck in the bureaucracy. And this cadence has helped us to actually show some action on the ground. What have we been able to do? This year, we created and published the largest inventory of hospital emissions in the country and we believe in Asia. 40 of our hospitals, 23 clinics, and 5,500 pharmacies are covered under our emissions framework. That's 85% of our emissions. So when you look at what can you do, start with your hospital, because it's possible to do it for 40 hospitals in a single year, and we have published that information that's out there. Along with that, when we had board attention and when we galvanized action on the ground, we had results that we are incredibly proud of. Through our Smart Joules program, 221 initiatives across the board are actually in vogue. We've signed to the United Nations Race to Zero program, where we are committed to becoming net zero by 2050. And some of the action is yielding results that we've actually published. We are now at 18% in terms of the renewables that we use for all our energy. But the board told us, don't sit on that. What are you going to do with it? So we're committed to having 25% energy sourcing from renewables by 2025. And by 2028, that number is going to become 30%. 30,000 gigajoules of energy has been saved in the past 2 years. 187 metric tons of waste has reduced from pre-COVID years that we measured against. And 17% reduction in hazardous waste. So ladies and gentlemen, this is possible when you involve the organization, when you ensure that everybody becomes part of the process. And I'd like to just leave you with 4 things that are important. The first is to humanize action. We need to make sustainability contextual. We all talk about the low-hanging fruit, but who's the fruit picker? When we talk to a nurse and they ask us, how can we contribute towards climate action? We should tell them that you need to contribute towards biomedical waste management correctly. That's your contribution to the larger goal. So contextualizing what every staff member, healthcare worker needs to do. So humanize action. Second, socialize the cause. We need forums. We need to create awareness. We need training. And we need to create projects that actually galvanize action. And some of these can be high impact and low intervention, and some of them can be low engagement but very high impact, like moving to renewables. Third, let's capitalize the cost. This is going to cost money. We need to align resources to this cause of sustainability and climate action, and that includes resources, manpower, and technology. And let's actualize partnerships. And what do I mean by that? Net zero is a zero-sum game. What does that mean? Every part of our value chain needs to get to net zero before the entire health system becomes net zero. So the sum of all those net zeros will lead to net zero for the health sector, and it's possible with partnerships, whether it's with utility companies, with your vendors, with the transportation, supply folks. It is possible, but we need to actualize those partnerships in the years ahead. Ladies and gentlemen, I wish that when this Congress celebrates its 50th edition, which is not very far, we will look back at 2023 and say that that was the year when the healthcare community came together, galvanized itself to take action on sustainability and chart a path towards net zero. Thank you.
So it is possible, and I would like to invite all of you in the audience to use your app to pose some questions so that we can make best use of our audience here, our panel here, to really answer some of your questions. But I'm going to ask a first question, because we now know that it's possible. You're successful leaders, you're fantastic at what you do. So how do we avoid greenwashing, and how do we protect ourselves from that? Because actually, this is going to get very serious soon. So I wonder if anybody would like to start on that. Karen, I see you're jumping up to it.
That's a very interesting question and pertinent as well. We've seen greenwashing in many industries and sectors. And we are not immune to it, and as people get into it, it is going to become an issue that we need to really parse out from what is real and what is not. And some of it is not sinister. We've seen the concept of wish cycling, where people buy products and they feel that this is recyclable, even if it may not be. So awareness for staff, accountability for the leadership, and more disclosures, which should be auditable, is the way to go to at least prevent some of the greenwashing. But it should not stop from us taking innovative steps to look at newer ways to do things. Even if they are low impact but high engagement, we should actually invest in those, because now is the time to get every healthcare worker on the journey of sustainability, but better disclosures, audits, and leadership accountability is one way to go.
Thank you so much. So anybody else want to answer that question? Otherwise, we've got a pile of questions that are coming in here. And one of the one that's made its way to the top is, how do you really engage with your hospital team on these sustainability initiatives? How do you really get them hooked in so that this becomes something that's a golden thread in your organization? Tosif, would you like to start maybe, and then we can see if anybody else would like to answer that one?
I think what's most important, Sonia and ladies and gentlemen, is what is the purpose behind it? I mean, what is the real end game of it? I think if we are able to deliver the purpose, why we are doing it, but here I think monitoring and evaluation plays a key and very critical role. That you have done XYZ initiatives, what is really the impact of this at an individual level, at a department level, and also at a hospital level? I think that in itself will be able to drive results.
Thank you so much. Miguel.
Well, I would say that when you want to change something, you have to create a sense of emergency. So if you account, you make in our organizations, we are so focused on treating people, on our everyday life, that we don't have time to think about these things. And so, if you want to change, you have to create the emergency of this change. And to create the emergency, you have to measure, and you have to explain what's happening. Everybody sees TV, floods here, thorns there, etc. We see this. But if our staff understands that this what's happening that we see on TV and sometimes in our houses, this is something to do what they are doing, how they are doing, they will have this sense of emergency. And so this is the start. And then it's necessary that step by step you do some projects, sometimes a very small project, like we did in our laundry where the sewing women start to, instead of throwing away the old sheets, she understood that she cut the big sheets in small sheets for pediatrics. And so instead of throwing them away, we reused it. This is a very small project, but this has impact.
Thank you.
Because every long way starts with a very small step. And the importance of these small steps creates awareness in the people.
Thank you so much. There's another related question that I'd like to pose to John Perlin and then Her Excellency Mubarak Ibrahim, because it's really, how do you get your board into the place where they take this as a core value? What does it take to make sure that your board sees this as a core value? Now, I know, Jonathan, you came into your role at the Joint Commission enterprise with this as a core value. So what has it taken for you to do that? And then I'm going to ask the same of Emirate Health Services.
Of course, a key responsibility of governance is the stewardship of mission. And for an organization like the Joint Commission, just as it was for the healthcare system that I worked at before, it was providing care, caring for the community. And as part of that, whether it's Joint Commission or whether it's direct healthcare delivery, there is stewardship then of health, there is stewardship of patient safety. And so making that connection, as Tosif and Miguel articulated, between mission and into heart and internalizing with facts and data that creates urgency, I think was the way of creating ownership amongst the governance level so that it's a shared responsibility with management and leadership.
Thank you so much.
If I may add to my colleagues, and I think the thing for us to empower how we can adopt the sustainability issue is the leadership. From back home, we are blessed that we have a leadership that they have seen that sustainability is a must that should be incorporated in all the industries within the UAE. So we had visions, or we had, I can say, strategy that has been set since the 2021, where actually in that strategy we need to align all our visions according to that, where we are building sustainability in our current operational plans. And it said, yes, we might be using, starting with small project that can see the effect of it. But if you get that type of support, and I think also the budget behind that, because sustainability at the end, we will be having a lot of projects, a lot of tools that we need to implement to reach that, and I think we can be able to manage to have a better outcome.
Thank you so much. So I'm going to turn to Professor, because one of the questions that's coming up a lot here is what might be the first steps for any hospital to start on a sustainability journey? And I know you've chosen green buildings as your first area. Do you want to just tell us maybe why you chose that as a first step? And then I'm going to go around the panel and ask what else would you suggest as first steps for any organization out here who wants to get started?
Okay, I think the green building, in a hospital building contain a significant amount of energy consumption and greenhouse gas emissions. For example, the air condition and the lighting system. Therefore, the concept of energy saving is very important for the goal we want to achievement. And as we know, in Taiwan, the green building has the criteria for the ecological enzyme saving and waste reduction and the health. We call it EEWH criteria. So our hospital view such kind of the green building certification. It's objective and very effective means for the future, the goal of the energy saving. So I think the green building is a very standard guideline there. We can reach it step by step. That's our point.
Thank you so much. I'm going to maybe ask Karen to say, well, what might be the first steps? But one of the questions that's a little bit further down, and I know it's on people's minds, is this going to cost money, or can you save money by implementing these initiatives? So maybe you can think of what are the first steps that any hospital can take anywhere, and what might you say about the financing?
Yes, so the first steps would be to actually get the decision makers in your organization to sit together and actually chart out for yourself what is the purpose that you're assigning to a sustainability initiative. I think that's step number one. And it should very clearly mention what you're trying to achieve through this. I know every organization runs initiatives on savings, on energy efficiency, on reducing waste. But it needs to tie into a program together. And just prior to that, you need to step back and really take a hard look at where you want to go with it. Take your time. That is the second suggestion. Yes, there's a call for action to move quickly, but at the same time, if you have a good short-term, medium-term plan, that will actually yield better results as time goes by. The first immediate step after, say, you've charted out what you want to do, would be to look at what your carbon footprint looks like. I think that is a fundamental step in this journey of getting to net zero, or even if you're not ambitious enough to get to net zero, to look at considerable reductions in your emissions, but that starts with looking at what your emissions looks like. Now, without getting too technical, it is fairly simple. These consumption numbers and data sits in somewhere in your organization already. So the effort to pull that out is minimal. So you don't need to reinvent the wheel. Water consumption, energy consumption, purchased electricity, waste generated. And if you're an accredited organization from, say, the Joint Commission, this data would be in a set format that is sort of charted and measured. So that's the first important step to look at it. And then you've got to assign roles to who's going to be doing what on a credible plan towards reduction. In terms of costs, I think these are opportunities and investments. And this sounds very cliched, but it is actually true. Some of the investments that you would need to make are going to accrue results in the mid to long term. But the technology is moving so fast that you would have the opportunity to upgrade along the way, and some of those costs will get absorbed. Some of those costs, the returns are fairly quick. If you move towards LED lighting, for example, fairly quick, a quick win, and the payback happens in a couple of years. For the other longer-term ones, there is a life cycle assessment that people, the planning and strategy team would need to do. But the fundamental bottom line is that we need to put money where our mouth is, and it will. That's why I said we need to capitalize the cost. Let's look at what it is going to cost us. But it's an opportunity and an imperative, and that's the opportunity we should tap onto.
Tosi, if you were in a lower resource country, do you want to make a comment on the financing? How have you worked your way around that?
Usually the most difficult thing is getting started. Often green is always thought that it's expensive. You need climate financing, you need green funding, you need green bonds. But my suggestion would be to start small. And even if it's those baby steps that you take, you must start with the end in mind. I think often, countries, especially in the emerging markets, have various challenges. And some of the challenges are creating that level of awareness that are people really green conscious? Do they know about green? The second challenge that we often face is that Dr. Perlin will be able to relate is that we're just about to go for the Joint Commission International Accreditation infection prevention control standards. That are we able to adhere to those standards, deliver high quality, and yet recycle? That's the second challenge. And then, of course, the demand. Like my colleague said here, that is there a demand for green buildings in the country? So all these are competing factors in an organization. There are budgets that are competing for the same, but just like the way we don't need assistance in the morning to brush our teeth, we don't need someone to tell us to be green.
Thank you. Her Excellency, would you like to, or Miguel first?
Just a brief thing to say that there are some action that needs investment and has return. I would say, for instance, we put the solar panels for electricity production, and as the prices rose so much lastly, we are getting the feedback in 2-3 years, so the payback is very quick. There are some investments where you invest and you don't have financial return. I would say, for instance, what we made capturing the gas, the anesthetic gas. We are capturing the anesthetic gas and we invest, and we are not getting money back. But we had other thing back that is very important, is that our anesthetic team is very happy with that. Yeah. And our anesthetic team, they had a very good and very important role on this sustainability transformation in our organization with the first project that was awarded last year. So they deserve that we do this investment with them. So I would say that these investments, some of them have return, and some of them we have to assume that this is investment on environment sustainability. And we have to create this balance and taking care that the importance that we get people on board with these actions is also a kind of return that we can get.
Thank you. Did you want to add anything to that? Otherwise, we'll move.
I do agree with my colleagues, but the most important part I said is that we need to, as she said, the purpose, and also we need to know where we need to start and from where we need to start. It's a huge, areas that we can do the sustainability initiatives, but we can, as you categorize them, and then work slowly in adopting these type of initiatives. If it's a budgetary constraint into it, that can be at the end of the of our plans, but there are certain things that we can do from day one, like we have done in the UAE when we have adopted the virtual clinic and we did the carbon footprint. That wasn't easy. We have utilized our AI platform where we have actually done the machine learning to predict the travel of the people, and we have successfully managed to do the reduction with 20%, and that was with no extra charges for us. It was mainly the AI application that we had and adopting it to manage with us the sustainability part. Thank you.
Thank you so much. So one of the questions that's coming up, really, it relates a little bit to going beyond the hospital walls and how much maybe a hospital might be interacting to support its community on this journey. And I just need to make a shout out to Aruba Hospital. I don't know if the CEO is in the room, but I heard at the dinner last night that that hospital is actually making loans to patients, staff, and the community for solar panels. Return on investment 2 years, and it's the hospital that's being the loaning company to make sure that the whole island is going forth. So that's an example of how a hospital can actually reach out and take a lead in its community. I was wondering whether any of you have got examples where you're taking into account the needs of your community and the changes that climate change are going to bring, and that you're incorporating that into your plans. Tosif.
Thank you for that question, Sonia. And I'd here like to share with you a very interesting concept that we recently installed. It's just about 6 months old. 1.5 hours away from Nairobi City, we have a tree planting drive initiative that we have carried out. It's in a place called Kirinyaga. And what we've done here is not tree planting, but we're calling it tree growing. Because what happens, and I think you mentioned a few moments ago regarding greenwashing, it's become more of a PR project that we have planted X number of trees. So in this particular county, what we do is every month we go and plant trees. But what's most interesting is that the community there is benefiting from this, because these are not just normal indigenous trees, but these are fruit trees that are able to feed the community that is there. It is creating a source of livelihood that is in that community. Now there are farmers who are having nurseries because they know we'll come and buy the trees and the seedlings from them to be able to plant the trees there. So it's created a little haven for them. It's created a source of income for them. And the most important thing is that they're able to even send their children to school with that kind of money.
Fantastic. Any other examples? I know in India you're doing similar things.
Yes, one other example is on telehealth. I think that is one very high impact initiative that we have undertaken under the aegis of the Apollo Telemedicine Health Service, ATHS. And there we are reaching out to communities which don't have geographic access to hospitals, but also at the same time working with them to make them more aware of some of the ecological challenges that exist in those areas where they live, and also train the staff, and this is usually staff on the other end of the telemedicine line, on the challenges of environment and environmental health, so that they're also more aware of what they should be seeing and how they should be acting. The other is through community camps that we run close to our hospitals, and what we've tried to do is to actually train our workforce that goes for these clinics is to also have a 1-hour session where they're talking about environmental health. So it is about the common challenges that the environment or the climate change is now putting onto the local community. It could be heat, it could be air pollution, it could be risk of flooding. Children especially, or the young, are being made aware of these challenges, and we see that the awareness levels are rising because of that outreach, because and that's the advantage that we have as the healthcare community. There is an incredible level of trust that a doctor and nurse or a health professional enjoy, and when they talk about the ecology, climate change, and the anthropogenic nature of climate change, you would find a lot of people actually agreeing to it and taking your advice.
Thank you so much. So I'm going to give our panel a little bit of a warning that I'm going to ask for a parting message very soon. But I do have one question that's being posed to us as a little bit of a challenge, really, because we talk a lot about net zero. And I've heard people say, but why are we aiming for zero? Zero is not a very attractive place. How do we make it more attractive? Could we be talking about something that's maybe more net positive? And some of these initiatives that we're talking about in the community and how we reach wider could be calculated as a positive beyond the hospital walls. So is there anybody who would like to say anything about that? And then we'll do a round of closing remarks, and then I'm going to leave the last closing remark to John Perlin. What do you think? Net positive?
I would say instead of saying that you want to reach zero, you say the opposite way. You measure how much you are capturing, and you said you figure out this number. It's much more attractive because our actions, even the small, they take some results. And so it's better instead of saying, and I have to say that I didn't think about that. But in fact, you have to go for the positive way, which is saying what you have done and not that you are running for zero. You are not running for zero. You are running for thousands of kilograms of dioxide that you are capturing.
We do talk about zero tolerance to things, so we've got zero tolerance to carbon, but it's just useful because there's so much terminology out there, and I guess I would just like to say, don't get fazed by it. There's so much that we can do without worrying too much about the terminology. But maybe we can go for parting remarks. Professor, would you like to, what would be your parting remark to the audience? What would you like to be your key message to everybody today?
My key message is, I think the energy conservation and carbon reduction both are essential, and it never be too late. Let's do it together right now.
Thank you so much. Tosi.
Thank you, Sonia. Leadership is not a popularity contest. Let's use our influence as leaders. Let's use our power, position, and titles to influence others, to make that call, to push the sustainability agenda forward, and to be able to drive results that are measurable, yet they have impact not only on us as hospitals, but the wider community.
Thank you so much. Your Excellency.
Well, my takeaway is actually, first of all, I've enjoyed today's panel discussion. And I think from my side, I'm going to take this curated input and see how we can work on EHS and the UAE to implement some of the suggestions that has been here in the panel. But going forward, I think what I've seen is that now the sustainability is becoming the center of the global agenda.
Yeah.
And with that, it's actually we need to educate, we need to understand how we can manage our ecosystem to work towards the net zero. And on top of that, we need, as humans, to learn how to live with nature and nature resources. Unfortunately, what I'm seeing is that we're not doing that. We're talking about net zero, but we at our home, we are not using the simple methods of how we can do the net zero. So I think it starts with us. We need to be able to be open about it. We need to be able to adopt it. And we need to start from ourselves first and then get the rest of the people to work with us on that one. And going forward, I think it's for me, I feel I'm really positive that things will happen, because I can see collaboratively the world is working towards that. And that by itself is an indication that we will be moving somewhere. The COP28 that's going to happen now in the UAE is actually a big example that all the leaders of the world are really serious of taking measures in doing the COP0. So hopefully we will be able to achieve not the net zero, but the zero part, but I don't know how we're going to do it.
So it's about global stewardship.
All right.
Really. Thank you so much. Miguel.
I would say that first you have to be trustful. This is very important. When you lead, people must trust you. If they don't trust you, nothing can be done. So be trustful. Create in your staff the sense of emergency. Help and support them. Empower them and make them the main characters of this movie that is health sustainability and environment sustainability. If they feel that really they are treated as the main characters, they can do very incredible things and then can do the change that we need.
Thank you so much. Dr.
I think the health sector is the most inspiring sector to work in and be a part of. in the past 100 years, the type of achievements that the sector has done for human wellness, disease eradication, for tobacco control, and most recently COVID. And now I think the challenge is upon us to look at how can we create healthy people on a healthy planet. And that's why if we talk about an equitable, accessible, affordable health system, it needs to be sustainable. This lexicon needs to be part of the central paradigm and not a separate discussion. And that would be my take-home message.
Thank you. So before I hand over to John, I'd just like to say we've got so many questions here, and we've only been able to cover a small percentage. But I'm sure that the panel and my team would be very happy to consider all these questions and post some answers, and maybe we can commit to doing that on our website at some point soon. So thank you very much for all your engagement in these questions. Over to you, John. I think you're
Well, thank you. What a wonderful set of discussions. And there were a number of themes that I heard through the course of these comments. Many were overlapping, but from Kenya and Portugal, the conversation about really changing hearts. And from UAE and Taiwan, changing technologies. And from India, changing leadership systems. So there are a lot of opportunities here in the wisdom that our colleagues imparted about what they're doing. And these interdigitate with some themes of the conference. In the conference, we've heard a lot of conversation about the finance of healthcare, of cost. Heard a lot about workforce and a lot about mantras. So let me take those in that order. In the area of cost, there are some areas that require investment, but there are also savings. And I just would commend the Carbon Emissions Learning Lab and the Sustainability Accelerator tool that are a part of the Geneva Sustainability Center as a way to model what is the cost in the near term and how quick is that payback, because sometimes it's very, very rapid. We're seeing that in the United States a good bit. The second is that there is this absolute interlock between the cost of healthcare today and workforce. Just by show of hands, in this post-COVID environment, how many of us are dealing with challenges of workforce and workforce staffing shortages? Sorry, I should have asked who's not dealing with that. Well, did you know that worldwide, the Robert Half Company has surveyed health workers between 18 and 34. They don't want to work for organizations without a sustainability program. And in fact, you can imagine that it's rare when we're out as the Joint Commission surveying that our people are asking for more standards. They are in this area. So if you want to demonstrate your environmental stewardship, this is a tremendously important way, and it's one of the other forms of payback. And finally, let me just hit one other area of the theme, and that was the mantras. We heard some great mantras from leaders throughout the conference. But Don Berwick is always good for borrowing a mantra. And he said one of the great things about benchmarks is that they're not theoretical. Someone is doing it. And here you've heard great examples of not only someone, but institutions and entire countries doing things that are acceptable, or are exceptional. That Don has also said that soon is not a time, and some is not a number. So in terms of greenwashing, we really need to be metric. We need to measure. We need to have goals. We need to find a more positive way of framing those goals, perhaps, but we absolutely need those goals because, indeed, soon is not a time, and some is not a number. And you may recall from our very first day, in the mantra of the morning was probably the simplest. Just 3 words. Just do it. So I hope all of us leave here inspired, empowered about what can be done across a spectrum of circumstances. And I would just say thanks for the inspiration that you've given us to go back and to do more. Back to you, Sonia.
Thank you so much. So just do it, and it's really a message of urgency, a message of hope, and a message of optimism. So I'd like to thank all our speakers and our panelists and all of you for being here today. I do have some key messages afterwards, but let's do a big round of applause first. Thank you so much. So to help us spread these messages, please make sure that you post all your key takeaways, post them on the Congress app, and post them on social media so that we can keep sharing all our knowledge and building that movement. We really need you to demonstrate that the leadership of hospitals is taking this seriously and is integrating it into every action. So thanks for doing that. We're going to have a coffee break soon in the exhibition hall downstairs, so please do, and then there's going to be a set of parallel sessions, so do make best use of those. You can also still view all the posters, and my goodness, aren't those posters amazing? There's so many inspirations in those posters, so please take the time to read them. I've heard of a number of people who are taking pictures and then posting them on further, so share them widely, because this is how we learn. And please also make sure that you join us back here at 12:10, because we've got a closing ceremony. We'll hear from the regional director of the WHO Europe region, and also we're going to hear from the IHF Portuguese consortium. You're going to be handing over to the Rio World Hospital Congress, because we know we're only 11 months away from that now. And more importantly, or maybe as importantly, we're going to be handing over the presidency of the IHF to Dr. Muna Talak from the UAE, and we're very proud of that moment. So please join us, and thank you very much for being here today. Wonderful audience.